80 to 85% of all spinal injuries are the result of compressive forces. What we're able to do is, in a very controlled protocol way, be able to decompress or reverse engineer what got you there in the first place. And the recovery time, people are having results of 8 to 9 months being pain-free and radiculopathy-free.
I've been lucky enough to be involved with spinal decompression since 2001. At that time, an orthopedic surgeon, a close colleague of mine, and I wrote a paper on the economic benefits of spinal decompression compared to spine surgery, and it was like 1/100th the cost of spine surgery. It had a big impact, and it's something that because of the Medicare rules in the past had a bias against spinal decompression, has been a big disservice to this country. Many people are walking around with spine surgery now that could have avoided spine surgery. I'm very passionate about this.
It's extremely effective, knowing that 60% of the American workforce is inhibited from going to work every day because of back pain. Spinal decompression after 1 or 2 treatments can get you back to work, back to your normal capacity, and even help you return back to your normal activities of daily living.
We have patients who have degenerative disc disease who may need to come back once every couple of months for 1 or 2 sessions as a tune-up. But that's all they need is just an occasional pull, we call it, to get their back going again by increasing the nutrients, oxygen to the disc from the bone marrow.
Think of a jelly donut in your hand. That would resemble a disc, and a disc is simply a shock absorber in between the vertebrae. Through life's forces and injury and chronic repetitive motions, those discs become compressed and you go from a jelly donut shape to a pancake shape. And with decompression, by pulling the spine apart, this big fancy word called imbibition occurs. And in English, what that means is the disc that is normally compressed and all of the fluid, the blood, oxygen, minerals, nutrients is squeezed out of the disc. By pulling it apart, imbibition happens and it draws the blood, the fluid, the minerals, the nutrients, and oxygen back into the disc, reshaping the morphology or the configuration of that disc, making it function, in turn, making it function like a normal disc again, taking pain away and restoring your range of motion.
Spinal decompression works so well because it's a physiological way of transforming the bone marrow, which is pure life, water, nutrients, and oxygen, into the disc itself.
Decompression since day one has put people back to work and got them out of pain without any side effects and a much longer lasting relief than the traditional forms of pain management.
It's a device that has no side effects or very few side effects. So it's not like giving medications, and it works so well. I would recommend spinal decompression to a family member or anybody over surgery, even my worst enemy. The reason is because it's safe, effective, non-surgical, and there's no side effects.
I think it's only a matter of time with the internet, social media, just even with the campaign that we've launched only a few months ago, we're getting a tremendous response and relief from the people that we're treating. So as soon as word gets out, I think we're only one of maybe a handful of facilities in Vegas that are performing this modality or this technique. If it was more prevalent, then I think the word would be out sooner, but because there's only so few of us, that it's going to take time. But again, results speak for themselves. And I think with the results we're getting, it's just a short amount of time that we will get busier.
People don't know a lot about spinal decompression because it's not mainstream medicine or has not been mainstream medicine. Many people, unfortunately, have the mindset, I'm going to do what the insurance pays for. I paid for that insurance. I deserve that treatment. Many of my most effective treatments are not covered by insurance. And I think a lot of us in this country have to get over that attitude for optimum health. I am strongly recommending that every patient with lumbar pain and even cervical pain go to spinaldecompression.com. There you can find a list of reputable providers around the country. This is a very well-managed and effective website which will answer many of your questions.